It has now been 2 days that Ravi is down with fever. His mother Sita, a poor landless labourer's wife, must wind up her day's chores before she can attend to him. The fever is high and he badly needs medical assistance. But the nearest primary health centre at Barbas is 23 kilometres of motorable road from Sitarampura. She will have to spend 300 rupees just to get there. But she doesn't have a choice. Sita and Ravi are unfortunate symbols of grossly deficient medical services in the world's largest democracy. The sorry state of medical and healthcare services smirks at countless faces in rural India. On an average, there are about 55 doctors to cater to every 100,000 people in India. The WHO estimates that more than 65% of India lacks regular access to essential medicines. A large portion of total healthcare expenditure is privately funded, and the proportion of patients who pay out of pocket is very high. Sky-high costs of health services force 40% of those hospitalized to borrow money or sell assets to meet these expenditures. To deliver effective health services to rural India, the government initiated the implementation of National Rural Health Mission, popularly known as NRHM, in 2005. Extensive architectural changes were made in the earlier framework for NRHM to gain success. Community monitoring and involvement of civil society organizations was made the core strategy.
The community monitoring fits in as a very broad system that would help to build in a system of accountability, which, while in one way is not a system of a stick, but works more as a carrot or a very soft kind of a mechanism.
To evaluate the current status of the scheme, CUT, Centre for Consumer Action, Research and Training, commissioned a study. Towards this, 30 primary health centres, known as PHCs, were selected from Tonk District of Rajasthan. For 30 days, 150 members of the Community Monitoring Cell made 900 unannounced observations to record the presence of healthcare workers at these PHCs during duty hours. A very high rate of absenteeism was observed in the service-oriented healthcare sector, which practically collapses in the absence of people who offer these services.
अगर हम दूदू की तरफ जाते हैं तो 25 किलोमीटर दूर जो है वो दूदू में पीएचसी है। बड़े आश्चर्य वाली बात है कि इतनी बीच में जो पीएचसी है उससे दूर तक आसपास कोई पीएचसी नहीं है, कोई मेडिकल सुविधा नहीं है, कोई यहाँ पे एम्बुलेंस नहीं है।
Citizen Report Card, a social accountability tool, was used in this study besides tracking absenteeism. It was observed that these PHCs do not have proper access to medicines. Villagers were unsatisfied with health service delivery and did not have much faith in PHCs.
डिलीवरी का मामला होता है, हमें माल पर लेके जाना पड़ता है, क्योंकि एएनएम कंपाउंडर वगैरह कोई है ही नहीं लेडीज। इस वजह से स्वास्थ्य विभाग को इस बात पे ध्यान ही नहीं देता। कई दफे ग्राम सभा में और में प्रस्ताव में लिख के भेज चुके हैं, मगर आज तक कोई सुनाई नहीं हो रही हमारी, समझे। तो लोगों का विश्वास इसलिए बहुत कम है।
हमें यहाँ एएनएम की बहुत समस्या आती है। अब हम डिलीवरी के लिए लाते हैं तो मतलब डिलीवरी वाली जेंट्स को नहीं दिखाती।
Owing to lack of medical stores in the near vicinity, the villagers preferred to visit quacks who stored medicines. At the other end, health service providers were unhappy with their working conditions and reported a shortage of medicines, medical facilities, doctors and infrastructural facilities at PHCs.
I'm sure after this exercise of the similar nature, at least one thing is clear in this, that general public becomes aware of it, that these are certain services which are available at their end. These are the people who have to deliver that service. These are the people who are directly responsible to see that the services are catered to.
These observations call for a closer evaluation of the implementation of the scheme. Service delivery can be considerably improved by ensuring community monitoring through regular interaction and involving Panchayati Raj institutions, and making people aware of their entitlements.
We tried to build the community monitoring model, in which we trained 150 community monitors, and we constantly monitor the services of the health at the primary health centers. And gradually, because of this community monitoring and civic engagement, we saw that the things are changing, and a lot of service improvement, and also the community is helping to health providers to give the better services. So it's a kind of mutual collaboration happening at the level of the primary health centers, where both service providers and service recipients both are working together, and this is the positive side of the community monitoring.
जब से ये कर्ट्स की टीम हमारे लिए एक बहुत ही बढ़िया तरीके से आई है, जब से ये आए हैं हमारे पास यहाँ इंटरफेस मीटिंगें हुई है 2-3 बार, हमने वहाँ चिकित्सालय में मीटिंग की है, डॉक्टर साहब ने भी सहयोग किया है इसमें, और उसके बाद में वहाँ मैं जयपुर भी गया हूँ, उसके बाद जब CMHO साहब से बात की ना, तो उनकी लैंग्वेज में फ़र्क था.
CUTS attempted to build community-based monitoring model in a few PHCs. Day-to-day functioning of PHCs was recorded and reported in meetings by the community monitors. These efforts brought about improvement in service delivery, better facilities at the PHCs, and reduction in absenteeism.
Based on our findings, our recommendation to the government of Rajasthan is to look seriously into the aspect of absenteeism in the health sector, which is bringing the service delivery to a standstill, and also the absence of the community-based monitoring model, and some of the successful interventions we have shown to pick up those community-based monitoring model and to replicate in other districts of Rajasthan. So that is the main message emerging out of this study, as well as our recommendation to Government of Rajasthan.
All efforts directed to improving service delivery can substantially bring out effective results by instilling community monitoring and building ownership of health services. Proactive participation is needed to reduce the agonies of the deprived rural India. Efforts need to be channelized to accord millions like Sita and Ravi with their long-awaited and rightful share of happiness.